therapy, but they fall into two broad categories. Psychodynamic therapy, the most famous kind being Freudian analysis, looks back on past traumas or emotional loss to understand the present. Behavior therapy concentrates on changing negative patterns of behavior or thought that contribute to depression. Today, most therapists draw on a combination of techniques. Brian started an intensive behavioral program that met 5 days a week.
They would listen, and through my talking, I could sort out in my own mind what I was saying and what was really going on.
Therapy can help change a person's hopeless and negative thinking. It provides guidance for adjusting to changes in life. It helped Brian return to the path of mental health.
Talking to a therapist is not giving up and saying, I need your help. A therapist is a guide, somebody who can help you figure out for yourself what's best for you.
Gee, which color do I feel drawn to today?
I gotta tell you, I'm drawn to that green one right on top.
Like this one?
Yeah,
right
I like
here?
that one.
In the therapeutic setting, there are many ways to express our emotions. Laurie Rappaport, a licensed therapist, surprises me with an approach called expressive arts therapy.
First, I teach people to just make a shape. And for people who don't know how to start, I might say, so can you make a wavy line? Or then I say, when people use the arts and creativity, it helps them access a part of themselves that's really vital and lively. And when you're depressed, that's one of the things that is kind of missing.
It looks kind of like DNA. Doesn't it?
There's some element of fun to it. So while it's fun, or it can be fun, it can also help reach the deeper feelings inside, or the sadness, or the fear, or the pain, or the loss.
This is also kind of focusing.
And how does that feel?
It feels very calm, actually.
Yeah.
I'm forgetting that you're there.
Art therapy can be combined with other forms of treatment. It is especially effective for children and teenagers who tend to have problems verbalizing their emotions.
With someone who has depression, you could actually ask them to kind of sense, what is the feeling of the depression? What does it look like? What color is it? What shape is it?
Laurie shows me several drawings that illustrate a patient's healing journey.
So this first one, you can see her down here where she's so little, next to this darkness. And then the big word, help me. This is the middle where more of the kind of darkness is coming out, and it's being put onto the paper. And this one was a drawing of kind of helping get some of the anger that she had inside out. You can literally see the changes that happen over time. So it's a way of transforming sometimes those ugly feelings into something that becomes beautiful.
Expressive arts therapy, which was developed in the 1970s by artists working in state mental hospitals, actually draws on a long tradition of using the arts, drawing, movement, and music for healing.
Oh, wait, I gotta play. Is this a rain stick?
That's a rain stick. In expressive arts therapy, we find ways to give voice to feelings. It's a way to take the energy that's inside and then move it. And that helps the healing process happen.
That's a waterfall is what that is.
Right. Like, what's the feeling of feeling depressed? Maybe
for me, it would just be silent.
It would be silent. So then that's what we would do. In a therapy session, what's most important is that the patient feels safe. The client-therapist relationship comes first. The methods and all of that come next. You kind of felt it, didn't you? Yeah. And that's what.
I like that.
Yeah.
I like the way it kind of resonates. It has this kind of opening up feeling to it.
Right.
Every morning when I get up, there should be a gong sound. Cat is awake.
If you're looking for a therapist, here are some points to consider. What form of therapy do they practice? What's a typical session like? Approximately how long might the course of your treatment last? Do they recommend and can they prescribe medication? What type of educational background do they have to perform this therapy? What is their fee, and do they accept your health insurance? Remember, the most important question is, do you feel comfortable with this therapist? Depression can strike anybody, but women are especially vulnerable. That's right. Women experience depression at a much higher rate than men. In fact, there are certain types of depression that only women get. Every woman alive knows her hormones can be unpredictable. We're up, we're down. 1 month good, 1 month a nightmare. Now imagine what happens when raging hormones collide with depression. Sue Kearns knows. 16 years ago, she was a brand new mother. The farthest thing from her mind was depression.
At the time, when I was diagnosed and I was so sick, I couldn't even believe that I had depression. I thought I was just a bad person.
Women experience depression at twice the rate of men. Part of the reason may be the very hormones that make us women.
As a woman goes through her reproductive years, her brain sees different levels of hormones, and estrogen in particular, at different times. And that changing level, the ups and downs of estrogen in her brain, may be one of the factors that increases risk for depression in women.
Estrogen is a vital hormone, but scientists aren't sure how it contributes to depression. After childbirth, it may have been a cascade of hormones that sent Sue into a tailspin.
I don't think I realized how away from my usual self I was at that time.
Sue was enduring postpartum depression, a condition that strikes approximately 10 to 20% of new mothers. Postpartum attacks women when they should be filled with joy.
Postpartum women who are depressed typically have tremendous anxiety. They suffer from tremendous doubt and worry and not being able to sleep and not being able to eat and not being able to feel completely engaged or bonded with their baby.
Postpartum depression can appear up to a year after the birth of a child. Sue started showing symptoms after 4 months.
My judgments were off. My decision-making, I couldn't make decisions. Part of my feeling that I wasn't doing a good mothering job was one time just getting a list of things that babies usually do at certain months. You know, baby sits up or looks at the ball or does this or that. And I was so sure that our baby wasn't doing it. And then she had a cold and whatever, and I was inappropriate in my judgments, you know, getting my husband to, you know, let's take her to the doctors, let's do this, let's do that. And that's when I was really showing signs of spiraling down with a depression.
Sue's husband realized she was suffering and got her to the doctor. Antidepressant medications were prescribed, but there was a complication.
I was successfully breastfeeding, and that part of postpartum was a really good experience, a good bonding experience for me and the baby. And then when I had medication to take, I had to make a choice.
Sue felt that if she took medication, she'd endanger her child. But if she didn't, her own life was at risk.
The information that we have thus far has suggested that it's been safe to use these medications in breastfeeding. We've got some blood level studies which show that even though the baby's getting exposed to the medicine, they're almost always able to process it. They don't accumulate it, and they don't seem to present with major problems. If people are breastfeeding, they need to decide with their doctor about taking the medication during breastfeeding.
Sue stopped breastfeeding and started medication. She took it regularly. But like many people using antidepressant drugs for the first time, the first set of drugs were ineffective. Her condition deteriorated.
I was really out of touch with reality at the time, and I was afraid that I had hurt Megan. I was here by myself with her, and in my mind's eye, I perceived that Megan wasn't breathing, and I called the ambulance.
When the paramedics arrived, they discovered a perfectly healthy baby and a hysterical mother.
Of course, the baby was fine, and Mom was the one that they were really concerned about.
Sue was promptly hospitalized. New antidepressant medication was prescribed.
This is a brain phenomenon. These are brain disorders It's not something you willed on yourself. It's not something you're responsible for in terms of causing it, but you are responsible in terms of taking care of yourself.
16 years